Welcome. This is the New England Journal of Medicine. I'm Dr. Lisa Johnson. This week, August 22nd, 2024, we talk about amino acid infusion and kidney protection, azithromycin to reduce childhood mortality in Niger, belzutifan in renal-cell carcinoma, and a transfusion strategy in traumatic brain injury, a review article on sexual dysfunction in women, a case report of a woman with aphasia, anemia, and a breast mass, and perspectives on a series of brief cases on efforts toward equity and on controlling global antimicrobial resistance. A randomized trial of intravenous amino acids for kidney protection by Giovanni Landoni from the IRCCS San Raffaele Scientific Institute, Milan, Italy, and co-authors. Acute kidney injury, AKI, is a serious and common complication of cardiac surgery. Reduced kidney perfusion is a key contributing factor. Intravenous amino acids increase kidney perfusion and recruit renal functional reserve. However, the efficacy of amino acids in reducing the occurrence of AKI after cardiac surgery is uncertain. In this multinational trial, 3,511 adult patients who were scheduled to undergo cardiac surgery with cardiopulmonary bypass were randomly assigned to receive an intravenous infusion of either a balanced mixture of amino acids or placebo, Ringer's solution, for up to 3 days. AKI occurred in 26.9% of patients in the amino acid group and in 31.7% of those in the placebo group. Stage 3 AKI occurred in 1.6% and 3% of patients, respectively. Kidney replacement therapy was used in 1.4% of patients in the amino acid group and in 1.9% of those in the placebo group. There were no substantial differences between the two groups in other secondary outcomes or in adverse events. Among adult patients undergoing cardiac surgery, infusion of amino acids significantly reduced the occurrence of acute kidney injury. Marlies Osterman from Guy's and St. Thomas Hospital, London, and Andrew Shaw from the Cleveland Clinic, Ohio, write in an editorial that positive results from AKI prevention trials have been rare. So, are the results of the trial by Landoni and co-authors strong enough to translate into recommendations for including amino acid infusions in clinical practice? There are some issues to consider. First, 336 patients, some from each group, underwent hemofiltration during cardiac bypass as part of routine practice, which complicated the evaluation of post-operative creatinine levels. Second, the trial infusion was ceased prematurely in 104 patients, which would have introduced bias against the intervention and thus should not be viewed as a threat to the validity of the treatment effect. Third, as recognized by the authors, an important limitation is the lack of data on actual tubular injury, because levels of biomarkers that indicate renal tubular damage, such as neutrophil gelatinase-associated lipocalin or kidney injury molecule 1, were not reported. Evidence is accumulating that many of the consequences of cardiac surgery-associated AKI are more common in patients with overt tubular injury, as defined by the presence of these and other biomarkers of damage. Thus, whether the reduced incidence of AKI is a functional effect or whether there was true protection from tubular injury remains unclear. The reduction in the incidence of stage 3 AKI suggests that the treatment effect is real, but the editorialists note that there was no difference in the incidence of any outcomes that affect how patients function in terms of general health, including the use of kidney replacement therapy, 30-day, 90-day, and 180-day mortality, median serum creatinine levels at these time points, and quality of life. Positive results from large, well-conducted trials should drive practice change. The study by Landoni and co-authors is such a trial. However, whether the results are due to a functional effect or true protection against tubular injury, or a combination of both, remains unclear. Azithromycin to reduce mortality. An adaptive cluster randomized trial by Kieran O'Brien from the University of California, San Francisco, and co-authors. Twice-yearly mass distribution of azithromycin to children is a promising intervention intended to reduce childhood mortality in sub-Saharan Africa. However, the World Health Organization recommended restricting its distribution to infants 1 to 11 months of age to mitigate antimicrobial resistance, although this more limited treatment had not yet been tested. In this study, 1,273 rural communities in Niger were randomly assigned to 4 twice-yearly distributions of azithromycin for children 1 to 59 months of age, child azithromycin group, 4 twice-yearly distributions of azithromycin for infants 1 to 11 months of age, and placebo for children 12 to 59 months of age, infant group, or placebo for children 1 to 59 months of age. Among 382,586 children, 5,503 deaths in 419,440 person-years were recorded. Lower mortality among children 1 to 59 months of age was observed in the child azithromycin group, 11.9 deaths per 1,000 person-years, than in the placebo group, 13.9 deaths per 1,000 person-years, representing 14% lower mortality with azithromycin. Mortality among infants 1 to 11 months of age was not significantly lower in the infant azithromycin group, 22.3 deaths per 1,000 person-years, than in the placebo group, 23.9 deaths per 1,000 person-years, representing 6% lower mortality with azithromycin. 5 serious adverse events were reported, 3 in the placebo group, 1 in the infant azithromycin group, and 1 in the child azithromycin group. Azithromycin distributions to children 1 to 59 months of age significantly reduced mortality and was more effective than treatment of infants 1 to 11 months of age. Antimicrobial resistance must be monitored. In an editorial, Catherine Maitland from Imperial College London and A. Sarah Walker from University College London write that, in the study by O'Brien and co-authors, mortality was significantly lower in communities in the child azithromycin group than in communities in the placebo group, among children when grouped as 1 to 59 months of age or 12 to 59 months of age. This finding was not replicated among infants 1 to 11 months of age in the infant azithromycin group, as compared with those in the placebo group. These results challenge most of the current recommendations for mass distribution of azithromycin, except for one, the specter of increased antimicrobial resistance. However, the effect of mass distribution of azithromycin on antimicrobial resistance as a result of this trial has yet to be reported. Further deliberations for guideline recommendations weighing the risks and benefits of mass distribution of azithromycin for communities and individual persons should not overlook the disease it was originally intended to control: infection with Chlamydia trachomatis. Trachoma has the highest global prevalence in the poorest and most rural areas of the Sahel. The most affected communities bear the brunt of this terrible disease. including high levels of severe visual impairment and irreversible blindness, with an enormous economic burden in terms of lost productivity. Trachoma prevention programs that provide azithromycin distribution to the whole population, in which strict prevalence conditions are met, will continue to provide indirect survival benefits to children. Belzutifan versus everolimus for advanced renal cell carcinoma by Tony Schwery from Dana-Farber Cancer Institute, Boston, and co-authors. Belzutifan, a hypoxia-inducible factor II alpha inhibitor, showed clinical activity in clear cell renal cell carcinoma in early phase studies. In this phase 3 trial, belzutifan was compared with everolimus, an inhibitor of the mammalian target of rapamycin, in participants with advanced clear cell renal cell carcinoma who had previously received immune checkpoint and anti-angiogenic therapies. 746 participants were randomly assigned to receive belzutifan or everolimus orally once daily until disease progression or unacceptable toxic effects occurred. At the first interim analysis, median follow-up 18.4 months, the median progression-free survival was 5.6 months in both groups. At 18 months, 24% of the participants in the belzutifan group and 8.3% in the everolimus group were alive and free of progression. A confirmed objective response occurred in 21.9% of the participants in the belzutifan group and in 3.5% in the everolimus group. At the second interim analysis, overall survival did not differ significantly between the groups. Grade 3 or higher adverse events of any cause occurred in 61.8% of the participants in the belzutifan group, Grade 5 in 3.5%, and in 62.5% in the everolimus group, Grade 5 in 5.3%. Adverse events led to discontinuation of treatment in 5.9% and 14.7% of the participants, respectively. Belzutifan showed a significant benefit over everolimus with respect to progression-free survival and objective response in participants with advanced clear cell renal cell carcinoma who had previously received immune checkpoint and anti-angiogenic therapies. Belzutifan was associated with no new safety signals. Liberal or restrictive transfusion strategy in patients with traumatic brain injury by Alexis Turgeon from the Université Laval, Quebec City, Quebec, Canada, and co-authors. Anemia develops in most critically ill patients with traumatic brain injury and may decrease oxygen delivery to a vulnerable brain and contribute to poor outcomes. In this study, 742 adults with moderate or severe traumatic brain injury and anemia were randomly assigned to receive transfusion of red cells according to a liberal strategy, transfusions initiated at a hemoglobin level of less than or equal to 10 grams per deciliter, or a restrictive strategy, transfusions initiated at less than or equal to 7 grams per deciliter. The median hemoglobin level in the intensive care unit was 10.8 grams per deciliter in the group assigned to the liberal strategy, and 8.8 grams per deciliter in the group assigned to the restrictive strategy. An unfavorable outcome is assessed by the score on the Glasgow Outcome Scale Extended at 6 months occurred in 68.4% of patients in the liberal strategy group and in 73.5% of those in the restrictive strategy group. Among survivors, a liberal strategy was associated with higher scores on some but not all the scales assessing functional independence and quality of life. No association was observed between the transfusion strategy and mortality or depression. Venous thromboembolic events occurred in 8.4% of the patients in each group, and acute respiratory distress syndrome occurred in 3.3% and 0.8% of patients in the liberal strategy and restrictive strategy groups, respectively. In critically ill patients with traumatic brain injury and anemia, a liberal transfusion strategy did not reduce the risk of an unfavorable neurologic outcome at 6 months. Sexual Dysfunction in Women, a review article by Susan Davis from Monash University, Melbourne, Victoria, Australia. Because there's no universal definition of normal sexual function, what constitutes sexual difficulty is determined by a person's subjective definition of unsatisfactory sexual well-being. The condition is usually described as unsatisfactory interest, arousal, orgasm, or other aspects of sexuality, such as sexual self-image, and these symptoms often coexist. The term sexual dysfunction is used when at least one of the symptoms is of substantial concern to the affected person. Sexual dysfunction in women is common and is associated with impaired well-being and quality of life. Many women with sexual dysfunction will not seek care unless prompted by their healthcare provider. However, there are no evidence-based screening recommendations for sexual dysfunction as part of routine care. Sexual well-being is determined by a complex interplay of biologic, psychological, and sociocultural factors. Therefore, an assessment of sexual dysfunction involves a comprehensive review of the patient's general health and psychosocial circumstances, and a history of the patient's use of prescription and non-prescription medications and other drugs. Full assessment will guide the management and referral pathways. Establishing the recency of onset and whether the problem is generalized, situational, or partner-specific is important. The management of sexual dysfunction should be guided by the patient's concerns and wishes, as well as by their physical and psychological health and social circumstances, and may involve a partner. Management pathways include lifestyle modification, counseling and psychosexual therapies, physical therapy, and pharmacologic therapy. A 59-year-old woman with aphasia, anemia, and a breast mass. A case record of the Massachusetts General Hospital by Seth Wander and co-authors. A 59-year-old woman was referred for evaluation of a breast lesion of 27 years duration. The patient had had limited medical care since she was 34 years of age. 3 weeks before the current evaluation, she had presented to another hospital with fever, confusion, and word-finding difficulties. At the time of that presentation, the patient was inattentive and disoriented, and mild expressive aphasia without motor deficits was present. She had a large, bleeding, exophytic mass in the right breast. CT of the chest, abdomen, and pelvis revealed a large cystic and solid mass in the right breast, measuring 14.9 centimeters by 16.2 centimeters by 20 centimeters. CT and MRI of the head provided evidence of an ischemic stroke. By hospital day 2, the patient's confusion and inattention had resolved, but mild expressive aphasia persisted. She underwent incisional biopsy of the breast lesion and was discharged on day 11, with pathological results pending. At a follow-up in the breast oncology clinic of this hospital, the patient reported worsening discomfort, bleeding, and drainage from the breast mass and the associated wound. Biopsy of the breast revealed carcinoma with a cribiform pattern that was infiltrating the dermis, with myxoid material present within the lumen. A pathological diagnosis of adenoid cystic carcinoma was made. On the initial evaluation of the patient at this hospital, it had become clear that she could not safely pursue even basic wound care and dressing changes at home without the risk of extreme life-threatening bleeding. Given the locally destructive nature of the tumor, the ongoing risk of bleeding and infection, and the highly atypical pathological features, her care team formed a collaborative multidisciplinary plan in the outpatient setting with ongoing input from the breast medical oncology, radiation oncology, head and neck oncology, and surgical oncology teams. The Future of Medicare and the Role of Traditional Medicare as Competitor. A sounding board by J. Michael McWilliams from Harvard Medical School, Boston. Medicare is at a crossroads. Enrollment in the Medicare Advantage program among eligible beneficiaries surpassed 54% in January 2024, up from 43% just 4 years earlier. The meteoric rise of this program, fueled by subsidies, has ignited debate about the influence of private insurers on one of the most cherished and enduring social programs in U.S. history. Some tout gains from market forces and innovation, while others decry profiteering and regulatory capture by corporate interests. Less debatable are the fiscal and structural challenges presented by Medicare Advantage. Because this program costs substantially more per beneficiary than traditional Medicare, an expansive Medicare Advantage intensifies the budgetary pressures that Medicare already faces as more persons age into eligibility for the program, and as per-beneficiary spending threatens to accelerate with the introduction of new therapies. A growing Medicare Advantage also means a dwindling traditional Medicare. Thus, with the dominance of Medicare Advantage set in motion, there are reasons to consider the future of Medicare with some urgency. To better leverage competition from traditional Medicare would require improvements to traditional Medicare, as well as cuts to Medicare Advantage. The approach must couple an increase in the generosity of traditional Medicare coverage, which increases Medicare Advantage payment, with an offsetting decrease in Medicare Advantage subsidies, which could be fine-tuned to achieve a desirably moderate net reduction in plan payments. Medicare reform will not be easy, but at this point, it cannot be sidestepped. With this issue, we feature a series of brief case studies on efforts toward equity. Transforming narratives of gun violence. Boston's reputation as a relatively safe U.S. city overlooks the depth and complexity of trauma, racism, and marginalization faced by the predominantly Black and brown residents of the Dorchester, Roxbury, and Mattapan neighborhoods, who live with deeply affecting sequelae of gun violence. Transforming Narratives of Gun Violence, TNGV, is a community-centered storytelling initiative launched in December 2021 and devoted to advancing healing and centering the experiences of the people most affected by gun violence in Boston. So far, 106 students, 44 community learning partners, and 7 faculty members have collaboratively created 4 documentary films, 3 long-form news stories, a role-playing game, a virtual reality experience, and several theater pieces. These works have been integrated into organizational trainings and policy discussions. TNGV focuses not only on generating better content, but also on developing better processes for sharing honest and authentic stories, crafted in environments built on trust. A multi-tier mentorship model, fostering inclusive pathways to health careers. Since a factor that limits diversity in the healthcare workforce is low recruitment and retention of students from historically excluded groups, There is an urgent need to broaden access to learning and mentoring opportunities that create pathways to biomedical careers. Tufts University School of Medicine launched STEM plus M Connect, which aims to foster a diverse healthcare workforce using a multi-tiered near-peer mentoring program for navigating key academic transition points by building career awareness, a sense of belonging, and social networks. Since the launch of Connect in 2021, a total of 9 undergraduate mentors and 37 high school students have participated. All 9 undergraduate alumni have completed or are completing degrees in a STEM plus M major. All 5 who have graduated from college remain in STEM plus M. 1 is in dental school, and 4 are in biomedical research positions, with 2 of those 4 currently applying to medical school. Of the high school mentee alumni, 24 are currently completing high school. Of the 13 who have graduated, 11 have enrolled in college, and most are majoring in a STEM or health-related field. Table stakes for equity: consumer demographic data at a state-based marketplace. Covered California, the state's health insurance marketplace, has designed an application for insurance coverage to encourage consumers to submit their demographic data. The approach has been successful. In 2023, of their more than 1.6 million enrollees, 80% had a selection for race or ethnicity, with only 7.6% selecting other race as their response. The actionable insights derived from their disaggregated data have been pivotal in forming budgetary decisions and resource allocation. An urban, farm-anchored produce prescription program: food as medicine and economic justice. 1/3 of Black and Latinx residents in Chicago are food insecure. Food insecurity was exacerbated by closure of supermarkets during the COVID-19 pandemic, which led to especially low availability of fresh produce on the city's racially minoritized West Side. VeggieRx is a produce prescription program anchored by the Farm on Ogden, a 20,000 square foot urban agriculture facility. Participants can redeem their prescriptions each week for 1 box of fresh produce and recipes, nutrition education classes, individualized dietary counseling, and cooking lessons. In fiscal year 2023, a total of 2,592 patients participated in the program, with more than 5,000 additional people receiving benefit from household access to fresh produce. In total, 18,895 produce boxes were distributed. 95% of VeggieRx participants reported consuming at least half of their produce boxes, and 31% reported a decrease in food insecurity. Academic Medical Center Public Health Partnerships for Outbreak Response, collaborating with under-resourced communities. Recognizing that public health crises often hit hardest in under-resourced communities, 2 academic medical centers, Rush University System for Health and University of Illinois Health System Chicago, UI Health, partnered with the Chicago Department of Public Health to provide rapid responses to outbreaks. Since the beginning of the COVID pandemic, Rush and UI Health mobile teams have administered 54,234 COVID tests and 19,528 COVID vaccinations at community-based sites. They have also delivered 6,031 mpox, varicella, hepatitis A, influenza, and measles, mumps, rubella vaccinations. Preventing and controlling global antimicrobial resistance, implementing a whole system approach, a perspective by Don Goldman from Duke University, Durham, North Carolina, and co-authors. Antimicrobial resistance, AMR, remains a major global public health problem, despite concerted surveillance, prevention, and control efforts. The World Health Organization, WHO, has identified AMR as one of the top 10 global health threats, with an estimated 1.3 million deaths attributable to bacterial AMR in 2019. The problem was gravest in Western Sub-Saharan Africa, where AMR-related mortality was 27.3 deaths per 100,000 people. The emergence of AMR anywhere can quickly become a global problem. These authors recently participated in a public-private collaboration aimed at assisting ministries of health and hospitals in Ghana, Kenya, Malawi, and Uganda in implementing, scaling up, and sustaining improved AMR surveillance capacity. Although success was observed in some domains, progress was hindered by systems-related challenges, such as lack of sustainable financing, supply chain deficiencies, laboratory staff turnover, clinician distrust in laboratory services, and failure to use culture results to guide treatment. These observations were in keeping with the author's previous experience in other countries. The authors believe several steps could be taken to accelerate progress. For example, countries and the funders and agencies that support them will need to develop and implement an integrated whole system approach to AMR. A whole system approach requires collaboration and coordination. Additionally, countries could better integrate plans for implementation, scale-up, and sustainability into action plans. In our images in clinical medicine, a woman presented with dull, intermittent lower abdominal pain on the left side. CT of the abdomen showed an ovoid lesion adjacent to the descending colon that had ring enhancement and the density of fat. A diagnosis of acute epiploic appendicitis was made. Epiploic appendages are small outpouchings of the colon filled with fat and small blood vessels. When the outpouchings become ischemic as a result of torsion or thrombosis, acute epiploic appendicitis results. In another image, a 68-year-old man with type 2 diabetes presented with a 3-year history of hardening of the skin on his neck and upper back. A punch biopsy of the posterior neck showed markedly thickened dermis with swollen collagen and dermal fenestration. A diagnosis of diabetes-associated sclerodema was made. In a third image, a 60-year-old woman with a 15-pack-year smoking history was referred with a several-year history of dyspnea on exertion. A chest X-ray showed hyperlucency of the lung bases. The serum alpha-1 antitrypsin AAT level was 19 milligrams per deciliter, reference value greater than 90, indicating an alpha-1 antitrypsin deficiency. Treatment with bronchodilators, inhaled glucocorticoids, and intravenous plasma-purified AAT was initiated. This concludes our summary. Let us know what you think about our podcast. Any comments or suggestions may be sent to audio@nejm.org. Thank you for listening.